If they have asymptomatic electrocardiogram showing atrial fibrillation, why do you have to do something about it?
Don't necessarily have to. Here's the two philosophies. One is rate control. Young person, 70-ish, is asymptomatic, can stay in atrial fibrillation, keep the rate between 60 and 100. Blood thinner, Coumadin or Eliquis to help.
So you have to use a blood thinner?
You do. You want to cut down the stroke risk. That's very important. But if they're rate control, absolutely asymptomatic, great quality of life, on a blood thinner, they can choose that. And that's a lot easier for people. You don't have to go back and forth. You don't have to take a lot of different medicines that have side effects. So rate control is fine if you're completely asymptomatic. It's usually very comfortable for people 70 and up to choose that approach.
So if somebody has rate control and atrial fibrillation, is the rate low because there's something wrong with the heart? Or do most people have to be on a beta blocker?
It may mean that the conduction is sort of slowed down a little bit, so the rate is slower than you would expect. Most people, though, when it goes above 100, 110, you need a beta blocker or a calcium channel blocker like diltiazem. Both the beta blocker and the calcium blocker will slow the heart rate, and that helps you achieve rate control.
Either one is preferable? Calcium channel blocker versus a beta blocker?
Both fine.
Both of them are fine, do a good job. So that's for rate control with those. You have to be on a blood thinner. Why do you pick one over the other?
Coumadin has been around 60 years. It's affordable, and the only issue there is you have to get a little blood test every 2 to 4 weeks. At the start, every 2, then once it equilibrates, every 4 weeks. The drawback to that is you have to go to the lab and get that test, but it's very affordable. The new ones like apixaban or Eliquis or Prodac, the ones that people like, Xarelto, no blood test. But there may be a challenge with the economics of it. These are new medicines that are sometimes more expensive. And for a while, there was no way to reverse bleeding. If bleeding occurred, you couldn't reverse it for 2 or 3 or 4 days till it just kind of ran out of its lifespan in your body. But now there are reversal agents for those. So they're all good. If you don't mind the INR, the Coumadin's probably a good way to go.